It's an old non-medical expression that you don't miss the water till the well runs dry. That's what's happening to American health. The present Health and Human Services Department is now ill-equipped to do many of the things that we've come to expect. The head of the agency does not believe in vaccinations, ignoring the science and even the clinical evidence, with measles spreading unusually across the nation. We can't trust any number of information sources, like the CDC or the FDA. Almost all the scientists working on climate change have been shackled, and important research through the NIH and major medical institutions has been stopped cold. Just yesterday, I found out that FEMA, the important agency in disaster recovery, is unprepared to respond to hurricane disasters. And that has tremendous medical implications. And the Congress is still trying to cut Medicaid and Medicare. Our patients are not safe, and as physicians and providers, that puts a much larger burden on us, especially in underserved communities. We now have to do our own surveillance. Outbreaks of disease in your areas have to be identified clinically. New medications and potential cures for chronic disease are on hold. And trying to get services for immigrant populations, even in California, traditionally, bastion of community health services, is now threatened. So where do we go from here? Standing up to protect the health of patients and communities is never easy, especially when physician communities feel discouraged. The constant stream of troubling news can make us want to retreat and focus inward. However, one of the biggest tasks during difficult times, and one of the worst things to do, is to stay silent. Standing up to protect the health of patients and our community is never easy, especially when physicians feel discouraged. The constant stream of troubling news can make us want to retreat and focus inward. However, one of the biggest risks during difficult times is staying silent. Silence in the face of this kind of turmoil, this kind of harm, this kind of inefficiency, this kind of ineffectiveness in health can lead to real consequences, with lives impacted and lost. So what can we do? Some ideas from the May 10th edition of the New England Journal of Medicine, 2025. First, help patients get the services they need. Talk with our legislators, both local and national. Support the Affordable Care Act, Medicare, and Medicaid. Join our medical societies and specialty organizations to enhance our impact. Partner with community organizations. Work to address health disparities for underserved and immigrant populations. Now, as I've said, is not the time to keep silent. If we do, we and our patients will pay.